My brother Logan has 19 years of complex medical history. He was born 6 weeks prematurely, and doctors and nurses were immediately worried. At the age of only 15 months, he received a small bowel and liver transplant. Now, Logan lives with lifelong repercussions. Due to his transplant, he's on medication for the rest of his life. Logan still currently needs frequent labs and doctor appointments for close monitoring. All procedures and things he has been through were life-saving. Pediatric nursing is worth learning about because nurses are struggling and so are the people they care for. The most common license is an RN, which is a registered nurse. To become a nurse, you will have to get your associate's degree, which takes 2 years. Then, you take the NCLEX, which is the final exam to get your RN license. However, most hospitals actually require you to have your BSN and Bachelor of Science in Nursing an extra 2 years. While in nursing school, you will also have to get anywhere from 300 to 700 hours of clinical experience depending on your school. Pediatric nurses assess patients and work with doctors to come up with a plan. They also administer medication per physician's order and do their best to make the patient as pain-free as possible. Unless you've experienced it, you don't understand how hard a nurse's job is, let alone a pediatric nurse. My aunt is a pediatric RN. When I spoke with her, she explained that the long shifts and hard nights can cause a burnout. At her hospital, she feels treated very well. Patients and parents are understanding, and so is administration and her bosses. Everything depends on how many patients she's assigned to and how sick or complex illnesses are. Losing a patient is never easy. She explained that the longer you work the job, the more you learn to sort of push your feelings away. What makes her love her job is how rewarding it is. Watching kids' faces light up when they hear they're going home, when someone finally gets cured, etc. Working with kids requires so much more than working with adults. They can't tell you exactly where it hurts, you have to explain procedures more in depth, and they are simply just more vulnerable because they are so tiny. Pediatric nurses also have to deal with the added stress of worried parents. Working on a child or baby is already nerve-wracking. Parents breathing down a nurse's neck is no help. Without pediatric nurses, society would suffer greatly. Without those doctors and nurses constantly advocating for my brother, he would never have received those organs. He was only on the transplant list for 7 months, which is a very short amount of time for the average wait. That is because he had healthcare workers on his side every day vouching for him. Without the transplant, he would not have survived. This is why we need to have pediatric doctors like the ones my brother was lucky enough to have. If a child is not fortunate enough to have supportive parents, there are doctors and nurses there for them. If no one is fighting for these children, there will be a lot more people with my brother's story but a different ending. Learning about nursing can open our eyes to something we don't normally see or think about. Day to day, there are so many things we take for granted. Our health is just one of the million things. We don't truly understand how fast our lives can change. We always tell ourselves, no, that wouldn't happen to me, but it can. You, your parents, grandparents, aunts, uncles, friends, every day there are new treatments and cures coming out. Science and scientists are evolving. Doctors feel the rush of a new trauma coming in through the ER or the unbeatable feeling of finally curing someone. Nurses get the reward of truly getting to know their patient and forming relationships and so much more. Don't you want to be a part of that feeling? Don't you want to advocate for those who can't advocate for themselves? Put yourself in patients and their parents' shoes and think about how you would feel.